Yeah.
Okay.
We're good.
Good morning, everybody. I think we have more people on the virtually than we do in person, but we're grateful for everyone that joined us here at the Adams board. I'm gonna turn this way. Good morning. Good morning. I would like to be able to do introductions before we get started. So if you just want to go around the room and introduce yourself, I think that would be great.
You're looking at me?
Yeah,
All
Lisa
right.
Carter, let's go.
Yes, good morning. Lisa Carter, CEO, South Community.
I am Anita Kerner, Program Director, and I work with the Caring for Kids program. My name is Jackie Price, Chief Operations Officer, South Community.
Jen Hopworth, Senior Program Coordinator at the Adams Board.
Morning, I'm Eric Schaefer, the Court Administrator at Montgomery County Juvenile Court.
And good morning, I'm Tiffany Doolin. I am the Intervention Center Director at Montgomery County Juvenile Court.
And then we've got Amber over here.
I'm on the comms team here for Adams.
And we've got Alex, our IT over here. And I'm Kimberly. I'm the Director of Treatment and Supportive Services at the Adams Board. And we are having the request for proposal for services at the juvenile court system today. And I wanted to be able to have people on the virtual call introduce themselves. So whoever wants to start. Or I'll call you out.
Hey, good morning. This is Jen Boniface, Vice President of Program Services for Goodwill Easter Seals, Miami Valley. Hello, everyone.
Morning.
Good morning, it's Nathan Lynch, Vice President with Lighthouse Youth and Family Services.
This is Nicole Spooner. I'm the Director of Grants and Contracts at Lighthouse Youth and Family Services.
I'm Ashley Downs. I am the Service Area Director at Lighthouse Youth and Family Services in Montgomery County.
Hi, I'm Marnie Maston, Program Director of Access Services and Intake for Samaritan Behavioral Health, and also I'm over our Butler and Warren County location.
Anybody else?
Good morning. My name is Autumn Green. I'm the Outreach Coordinator at the Preble County Mental Health and Recovery Board.
Good morning. Are we missing anybody else?
Good morning. My name is Sherry Hurst, and I'm the Fiscal Administrator for the Preble County Mental Health and Recovery Board.
Hi, Sherry. Good morning.
Hello.
All righty. Well, with that being said, let's get started. We're going to pull up the PowerPoint and start our presentation. For those of you that are on the online, can you let us know if you can see the screen?
Yes, we can.
Okay, thank you. Okay, so here at the Adams Board, we've been working in collaboration with the MCJC for several years now. And we are seeking a provider for the assessment and provision of services for youth involved with the Montgomery County Juvenile Court. And the goal here is to increase the continuity of care and accessibility to behavioral health services for youth within the juvenile court system. This is just a flow chart of some of the services that are currently being provided and that we would like to continue to provide at MCJC. And we look at the age range, which is 8 to 21 years old. And within the juvenile court, there's the intervention center, the detention. There's also probation. Here today, we do have the Director of Intervention with us. And Tiffany, did you want to share anything about specifically within the intervention department, some of the things that you are looking for specifically from the service provider?
You go.
For the intervention center, I'm assuming that everybody had a chance to read over our information, but basically we're looking for someone that is able to provide 24/7 crisis coverage. We are the front door for young people in Montgomery County. I don't know where they're for Montgomery County. So any young person who is physically arrested comes to our secure facility, as well as young people that can come in as a walk-in. A parent could come in because they're in crisis and they need assistance. And so we do this around the clock, and we would definitely need someone available to man our services 24/7. And I know right now with shortages of staff and so forth, that's problematic. We also have scheduled things that happen normally. We have specialized diversion programs that meet and have unofficial hearings. And some of those programs require a mental health aspect be present and include assessments as well. We're looking to use specific types of assessments moving forward. We are right now working with ACEs, and we plan to be working with Safe Harbor and human trafficking. And so there'll be some different assessments that we'll be bringing to the table for that. So just some flexibility also in the ability to bring on different assessments. Mr. Schaefer, I don't know if there's something else.
Kimberly, I think most of the people that are participating today are fairly familiar with the juvenile court, but is it important to know that this service provides to start screening for every case that comes to the attention of the juvenile court. And that averages around 8,000 kids that come before us in an annual period of time. Again, that's screening. And we worked really hard to develop a screener and a behavioral health screen that really helps us decide what direction cases go. And then this service also provides a diagnostic mental health assessment for kids who are determined to need one of those assessments, not just for mental health, but also for substance abuse. This service also then provides referral and connection to services once those assessments are done. Another big piece of what happens is it also monitors the kids who are detained. If I'm moving forward a little bit, Kimberly.
No, do your thing. I love this.
It also maintains service for kids who are in our detention center who have been determined to be high risk for suicidal or homicidal ideation. Again, this is a secure environment almost all the way throughout, so your staff would be working in a secure environment. In our detention facility, we have significant protocols and procedures for monitoring the youth that are in this category. The kids that are with us could be on a shroud and coverlet where they're being checked on up to every 5 minutes, depending on the severity. A lot of the kids that are in detention, when they're in an acute situation, are not able to go outside of the facility. So there are some acute scenarios that we're monitoring, but it's not something that we're doing all day, every day, but it does happen. And this service is a partner with us to make sure that those kids are safe. It also is providing those assessments that I mentioned to our jurists. So once we're deciding dispositional options for kids, we're really relying on these assessments to help guide a case plan and what we're putting in place for the kids that see our judges and magistrates. Those kids have a variety of options and a menu of services, and we work closely with the provider to make sure that we're engaging in. But of course, they include all of the things you're familiar with as standard outpatient, intensive outpatient, and residential treatment across the board. So you'll be interacting with those dispositional options. And when I say that, for the most part, the majority of those are our probation departments. Many of the kids that go through our official process are placed on probation. And we're maintaining those assessments and relying on those assessments to determine a case plan. Some of those kids are determined that they're in need of residential services and could go to our Nicholas facility for treatment. Or to our Center for Adolescent Services out of New Lebanon. That's our secure treatment facility, all of which we do some coordination of service to make sure that those assessments are understood and plans in place for their treatment when they're in one of those dispositional options. So this position or this service is housed in the juvenile court facility downtown. For the most part, it's interacting with Tiffany staff and the intervention center. But does come in contact and touch with all of the departments that are serving kids at the juvenile court. Was it off the top of my head shot at that?
I think it was great because you really followed.
Did I?
You followed this very, yeah.
All right.
Yeah, so I want to pass it over to our senior program coordinator, Jen Hockdorfer. She's been working with the prevention team on the Zero Suicide grant. And within that, she was going to share a little bit of information about the ACEs screening.
Sure. So one of the things that we are looking for is that the provider would also be doing ACEs screenings. And what we know about the ACEs screenings is that they will really look at the traumatic experiences that a child may have experienced between the ages of 0 and 17. And that could be everything from witnessing or experiencing any type of violence, abuse, even things such as substance abuse and other kinds of things in the household during those formative years. Because what we know is that individuals who have the ACEs, higher ACEs scores are more prone to things such as different mental health conditions. And we really want to start incorporating the use of the ACEs screening in helping to formulate and drive treatment for these youth as well.
Thanks, Jen. So very briefly, this shows just the provider expectations. We have several slides on this, and this just reiterates what you've already heard from Eric and Tiffany and Jen. The screening portion does include, not only is it that behavioral health screening, but it will also include the ACEs screening. Assessment with recommendations, and then being able to assist with the referral process, treatment planning, and then also doing provision of services while a youth is detained. And I do want to briefly touch on, I think everybody on the call knows what an assessment should include, so I'm not really going to read through all of these. I just thought it would be kind of fun to have a PowerPoint that looked like this, but when you're doing an assessment, it should be the full psychosocial assessment. It should obviously involve assessing that youth for mental health and substance use, as well as looking at their family supports, their social supports, educational information, medical history, any of those things, because one of the things I do know about the MCJC is they really do look at a holistic approach with how they treat the youth. The goal really is to try to have as few individuals as possible, I believe, detained. And I think you guys have done a great job of that, which is really where a lot of the work is coming from the probation, the intervention department. There's a ton of work in the detention department as well, but I really think trying to reduce recidivism and really trying to look at what are the natural supports that this youth has in the community and how can we try to pull all that together to best support these individuals so they can lead happy, healthy lives. So these provider expectations listed on this slide speak more specifically to ensuring that you have licensed clinicians. The licensed clinicians do conduct assessments, and those should be occurring daily. And it is, as I said, facilitating services for the youth in the community. We are looking at staff that hold a valid license with the Ohio Counselor Social Work, Marriage and Family Board. The preferred staffing pattern is 24 hours per day, 7 days a week. And then also looking at having a provider, whether it be a nurse practitioner, preference being a psychiatrist. And that would be at least 12 hours on a weekly basis. And there needs to be a psychiatric nurse also, that's 40 hours a week. All of this information will be sent to you after the meeting. So we will make sure that that is posted on our website. Is that right? Yeah. One of the things that we're implementing at the ADAMAS board, and that's going to be starting here, I think, with our prevention cycle for application for funding, and then as well as the treatment and supportive services cycle of funding, is that within the application for funding, there will be a DEI survey link that will actually be housed within the AFF. So when you, and if you decide to apply to be the provider for this particular service within the community, there will be a DEI link within that application. So we're really wanting to advance behavioral health equity across the board. And we definitely know that there are things that need to be addressed within Montgomery County, as well as within just some of the interactions, even with youth in the community. So be on the lookout for that. We also utilized and request that the services provided be evidence-based.
If I could chime in really quick, Kimberly.
Yes.
That is also very important to the court. As you know, the juvenile justice system is very much overrepresented by African-American youth. And we have, as a court, tried extensively and put things into place to try to impact that. So I'm very happy that this is a part of the proposal. As you know, you'll be partners with us in trying to make an impact there.
Thank you, Eric. I'm going to pass it over to Jen Hochtorfer again. So Emma Goldinger is our program coordinator of quality reporting. She is out today, so Jen is covering the slides that Emma would have typically been covering. So Jen?
Sure. So I think many of you are familiar with our quality reporting portal. And for those of you that are not, we will make sure that if you are awarded the contract, that we work with you to understand how our quality portal works. But the provider of these services would be responsible for quarterly quality reporting. And I'm not going to read every single thing up there, but basically we're looking at measuring and reporting things such as the number of youth that are screened, assessed, referred, the things that, Eric was really talking about. Also kind of looking at the timeframes from referral to screening and screening to the referral and the assessment. And then also looking at what is the impact that this program is having on our youth. And so looking at quality measures such as the number of youth who have successfully completed the treatment program versus number of youth who may be re-detained at the juvenile detention center. And so that will be done on a quarterly basis. Emma will provide more instruction on how to do that reporting, as well as how to access the portal. You can go ahead and forward the screen if you'd like. While it's done on a quarterly basis, we ask that that quality reporting be completed within a month after that quarter ends. And she will, again, provide all of that login information. In addition to that, we ask our providers to complete the Basis 24 and perception of care instruments as well, and provide some feedback to Emma on those instruments also. And then in addition to anything that we require, since we are funding it, if there are specific quality reporting guidelines for any kind of grants that you may also be utilizing, we would ask that you adhere to that also.
Thanks. I think we also spoke about DEI work as well as ACEs, so we're going to move past that. Some of the minimum requirements would be the ability to perform at least 5 screenings per day, the ability to perform assessments 5 days per week, performing a minimum of 900 assessments per year. The applicant cannot be on a corrective action plan with any certifying agency or national accrediting or licensing body.
Can I jump in? Kim?
Yeah, absolutely.
I think it's important. We try to quantify what this would look like, but there is no typical day. The intervention center is open 24/7, and we are open to law enforcement for whatever's happening in the community. So it says a minimum of 5 screenings a day, and we talk about these numbers, but there may be ebbs and flows, but coverage is key. We have to have the staff that are able to cover, and we wanted to at least provide some data in terms of what the numbers look like so that you understand. I mean, we are discussing minimum requirements. I think if we have to mention that the court, the Adamus board, all of us that are working in the behavioral health field understand that right now staffing is very difficult for all of us. And being able to find qualified staff to do this work, it's really important that I think you hit on that in your proposals is what your strategies are to do that and maintain the adequate number of licensed staff to be able to do that. I don't think all of them would necessarily have to be licensed, but we do need to be able to make sure that we're able to, in a timely way, conduct an assessment, get that approved and signed off on, and something that we could work off of. So I think that would be something that we would be looking closely at in terms of what a plan would be to come up to staffing. When you think about the numbers, of course, we're not going to dictate how many there needs to be at any moment, but at any given time, there's 12 to 15 staff, full-time and part-time, serving a 24/7 operation. Kimberly mentioned earlier that our preference is that we have somebody on site 24/7 based on police officers bringing kids to us 24/7. So that's important to make sure that we mention.
Thank you. And since I have this slide up, do you mind talking about the GAIN biopsychosocial assessment?
So one thing that we desire, and I know it's not as easy as it is said, we would like to be able to have an assessment tool that is universally able to give us data on in terms of what we're seeing trend-wise with diagnoses, possibly what types of behaviors we're seeing, an assessment that we can query easily to figure out trends or things that we should add or programming that we should desire to develop or programming that we may not need. One of those examples, and it's not the one that has to be used, is the Global Assessment of Independent Needs. It's done by Chestnut Health, and it's used pretty widely in the juvenile justice system across the country. But we would love to be able to see a provider be able to do something along those lines to be able to assist us in planning, program development, service development, and help us understand our population even better. So that is something that we would love to be able to see.
Thanks, Eric. Just some other evaluation criteria for the RFP, just ensuring you have Ohio Moss licensure, that you have a national accreditation, and are an affiliate of NAMI. Budget information, budgets will be determined based on the proposals. So when, we're gonna work kind of out of order here. So Jen here in a minute is going to talk about how you will get into the portal to be able to apply. But once you are in the application for funding, there is the materials link within the Resource Center and EC Impact, and that's where you'll be able to find the budget template. Please ensure that you have a unique entity identifier number and that you have a certificate of good standing from the Ohio Secretary of State. We also will need for you to provide a certificate of coverage with insurance, financial audits from your previous fiscal year, an organizational budget with direct and indirect costs, and then key performance indicators that can be utilized through your recent financial statement. And this just reiterates the licensure and accreditation requirements. And here is the list. You have to meet at least one of the following in order to be able to be considered for this RFP. Contract requirements and guidelines. Within the AFF, you will find a Ohio Moss assurance statement. That's also part of the contract. The financial audits and the insurance general liability that was already mentioned, you'll need to be able to upload that into the portal. The next slide goes over the occurrences, the minimum insurance liability that's required, professional employers. This goes through automobile, and you also need to be able to show evidence of having workers' comp. Funding upon the contract is contingent and upon the receipt of public funds. Adamus reserves the right to reject proposals and or fund less than the requested amount. Obviously, in this situation, we are working in partnership and collaboration with MCJC, so they will also be reviewing the proposals as they come through. Any entity that receives Adamus funding will enter into a contract with Adamus prior to any payment of allocated funds. All decisions of Adamus on the allocation of funds are final and contingent upon the receipt of allocations from Ohio Moss or based upon our levy funding. I'm going to pass it back to Jen to talk through how to apply for funding.
Sure. So first and foremost, if everybody will, who is on Zoom, if you will put your name and email address into the chat, I will make sure that we send out all of the PowerPoints and everything that we have today. I think I have everybody's email address who's in the room. Yes. So for those of you who have not applied for our most recent application for funding cycle and extension, we have a new portal access called EC Impact. So for anybody who is new who would want to apply for it, the link will be in this PowerPoint presentation, and you will apply through our EC Impact portal access. If you are new to EC Impact, there will be a button at the bottom of it that you will click to register. And then we would ask that you also send Emma Goldinger, and I will include Emma's email address, an email to say that you have registered for access. That way she approves it quickly and you can start that process. I think as Kimberly said, Emma is out of the office today. She will be back in the office on Tuesday. So I know that Kimberly will talk about timeframes. I will make sure to have Emma looking for any new registration access. If you are an existing user, you will just sign into EC Impact as you have previously. And one of the important things to note is whoever is going to be your primary agency contact is the person who should be requesting that access, completing and submitting the application. It's difficult to have, so we don't want more than one user per EC Impact. And then you will go in, you will enter all of your agency's organizational information into that. And basically from there, you're just going to follow each tab on the screen and complete the required information, upload all of your documents, and then fill out the actual application for this RFP. If you have any questions, you can watch the provider portal training that is on our YouTube channel, or you're always welcome to reach out to Emma and she can help walk you through any questions that you may have. Back to you.
All right, thanks, Jen. So just very basic, our contract process, we have the application. So for those of you that have worked with us before, we have our application for funding process. This is a separate component where it's specifically for one program, but it still follows the same trajectory, which is your application will be received and reviewed. There will be recommendations made to Program and Services Committee. Then there's the final board approval, and then contracts are sent for electronic signature. Application timeline, the application will be opening on January 15th of 2024. So please email Emma with who your primary contact will be, and she will be able to get all of that set up behind the scenes. The applications will be due by March 5th at 5 p.m. There's no exceptions to that. So if it's after that time frame, the application is not received.
Can I ask you a quick question?
Yeah.
With the 15th being a Monday and we are closed this Monday, will we still have it open? It's Martin Luther King Day, so I just wanted to make sure.
That is, thank you, Jen.
That's why I had mentioned that Emma would be back on Tuesday, because I realized what day the 15th was. And
I'm going to move that to the applications will open on the 16th. I have a really, really bad habit of forgetting about holidays.
She likes to work the holidays.
I like to work constantly. So applications will open on January 16th. Thank you for catching that, Jen, and I apologize to everyone for that error. The applications will be due March 1st. That gives you guys a good amount of time to really put together a good proposal. And then the notice of award will go out in April. You can email questions to support@adamus.org. We will also provide you with Emma's direct email. And I see that everybody put their contact information in the chat, so thank you for that. So basically that just leaves time for questions. If anybody has any questions for either Adamus staff or for Eric or Tiffany.
Can I clarify one more thing, Kimberly, before we move to questions? I think it would be a question. It's important to understand that the provider will be provided office space at the Juvenile Justice Center. Those staff will be on site there. The staff that work in this program are truly immersed with the juvenile court in terms of being on site. We will also provide telephone. We will also provide computers from the juvenile court, as long as that doesn't create a networking issue. That is something that could be worked out between organizations. Of course, sometimes we don't talk very well electronically, but the court will be providing those things and should not be considered an expense in your proposals. So those things are provided.
Thank you, Eric. What other questions? I'm gonna monitor the chat, and then are there any questions in the building right now?
Kimberly, just a clarification, under the outcomes for basis 24, we really don't provide that to the youth, that's an adult. So is that, just making sure perceptions of care, certainly, and if we have an 18-year-old, certainly, basis. So I just want to make sure to clarify that. as well as the perceptions of care would be the 12 and over. Is that, am I
So-
correct on that?
You are correct on
Okay.
that, and thank you for bringing that up. So let me see and we'll send you guys the slides. So our providers that are currently contracted with the Adamus Board do utilize Basis 24 and perceptions of care, and that does have age constraints on that. So as applicable, that can be utilized for the services that are provided. But I don't think that would be monitored, if I'm being very honest, to the level that just being in the quality portal and being able to answer some of those questions
Right.
that are in the
Just
quality
want to
portal.
clarify.
Yeah, and
because
I
it's,
appreciate that.
don't-
I do think it is important to mention that juvenile court age of majority is 18, but we do have jurisdiction of youth until their 21st birthday. So there are folks that come to us that are over 18 from time to time and may even be housed with us that are over the age of 18.
And one of the things I will do before we send out the PowerPoint, Jen or Amber, I'm going to go into the PowerPoint and put and add a caveat under the e-basis and perceptions of care to clarify that. What other questions?
Hello, this is Nathan with Lighthouse. I understand the role of screening, assessment, referral coming out of the intervention center. But Eric, could you talk more about the vision of the role in the detention center? And is that seen as a separate 24/7, I guess, coverage, secondary to, along with the intervention center coverage?
So logistically speaking, the detention center is one floor above the intervention center, moving up to the 4th floor. So the staff that serve have been known to float between the two, depending on the need. So the majority of the services that are happening in the detention facility are kid-specific based on need. And then, of course, on the weekends, we always like to try to provide programming, if available, that isn't the top priority. But if there are psychoeducational or other types of groups that could assist us in providing to the kids, those are always looked at as positive, but I wouldn't say it's an absolute top priority and requirement.
Okay, so it's a little both of crisis and maybe some short-term interventions, but also maybe some programming for the kids in detention.
If at all possible. And then based on the 24/7 nature and the unknown work level from time to time, based on what's happening in the community, sometimes we're just looking for those kinds of supports and they're time fillers, but also everything is done in partnership based on the schedule. The schedule for kids in detention Monday through Friday is pretty tight. They're going to school. They're participating in programming. Inside of detention is a program called J-Care, where we're offering a cognitive behavioral treatment program and planning for aftercare. So their schedule is even more tight in terms of the programming that's happening after school. So the weekends are where there's not as much happening, and that's where we're looking to kind of fill some support roles.
Okay, and could you also mention again the assessment that you referenced as an example earlier?
Yeah, just an example, it's called the GAIN, the Global Appraisal of Independent Needs or Assessment of Independent Needs, and I believe it was published by Chestnut Healthcare.
All right, thank you.
Again, that's just an example, Nathan.
Yeah.
What other questions? All right, if there are no other questions, we want to thank everybody for joining us. Do not hesitate to reach out if you think of a question later. I know some of us, I tend to do that. The question comes a couple hours later. We will provide an updated RFP and PowerPoint presentation that will clarify the e-basis perceptions of care. And I'm also going to correct the date in those documents. And can we correct the date on the website to January 16th when that portal will be opening up? Feel free to go ahead and email us at the support email or email Emma Goldinger so you can go ahead and say, hey, we're applying, so that she can go ahead and get that set up first thing Tuesday morning. This recording will be available on our website as well with a link. So just give us some time right after this. We're going to regroup and make sure we get all the documents in place that we need to. And I will also make sure that my email is on the website as well. So if you have questions, you can reach out to me. So I want to thank you guys for your time. Thank you for those that joined in person, and then also thank you to those that joined us virtually. And I wish all of you a wonderful weekend.
Thank you.
Thank you, everybody.
Thanks, Sarah.
Yeah.